founded two companies, Lundon Software, Lundon, with Dr. Gordon back in the 1980s for receptor binding software, and also Sir Isaac Newton Enterprises, LLC. These companies are scientific endeavors. The Sir Isaac Newton has a patent for controlling pain by controlling inside barometric pressure. And the current focus is on looking at COVID and what are the common denominators of these comorbid conditions that cause the moderate to severe outcome in COVID. Whereas when you don't have these comorbid conditions, you might not even realize you've been infected, or you might have a bad cold situation. In the early part of 2020, looking at the developing data, it became clear that the delay in symptoms from exposure appeared to have every aspect of a delayed immune response type 4, which involves particularly T cells and within the white blood cell population, mast cells, which can release cytokines. And if there's a hyperimmune response from this, then there can be tremendous amount of clotting, both arterial and venous. The antigen antibody type response is type 2 or type 3. Type 3 is when complements involved and immune complexes form. And type 1 is something you might get if you happen to have an adverse reaction to a vaccination. Small reactions to vaccination are commonplace and should not be a concern. Some people have more than that, and that's why these need to be done in a medical facility where there's somebody knowledgeable if you have allergic reactions, so they have appropriate care. So looking at the early data and recognizing the fact that there was a mixture of immune responses, but it seemed to be initially type 4 with a delay, I reflected on my experience with treating, recognizing, diagnosing, treating the spider bite of the brown recluse spider. It's quite venomous. It has multiple protein toxins, and once you have the bite, there's a delayed tissue response. There's some redness and swelling for a few days, but then it gets very severe after that, with the center of the bite turning dark with red bullseye rings and pink bullseye rings surrounding this. You don't want it to get to that point. Unfortunately, a lot of people don't recognize it for what it is and treat it only with antibiotics. Whereas, because of the nature of the reaction of the venom with the tissue and the T cells, the microvascular circulation is diminished substantially, resulting in hypoxia of the tissue and necrosis to the central portion of the bite. So it's important to diagnose it quickly and to treat it appropriately. And there are two different types of medications which can help to stop this hyperimmune response. One are corticosteroids, and the other one is dapsone. The dapsone is also used to treat leprosy. A short course of corticosteroids generally will stop this reaction and allow the microvascular circulation to resume, and then the wound will clear pretty quickly. Many practitioners will also add to that some antibiotic coverage. I found that if the bite is fairly fresh, then applying a poultice of a meat tenderizer right to the wound, just like in either an insect bite or a snake bite, will denature the proteins of the venom, and quite often that will substantially ameliorate the situation. But after that, the steroids or the dapsone typically is used. If you use surgical debridement, that does not stop the process. So you have to recognize it for what it is. So getting back to the COVID, my early recommendations were for the use of corticosteroids. And during the year of 2020, Oxford University presented their findings to the world that dexamethasone, which is a corticosteroid, was very effective in controlling the moderate and severe COVID-19 presentations at the hospital or in the intensive care unit. So that's consistent with what I was suggesting about the treatment of the brown recluse spider bite, venomous bite. Then I went on from there and extended on some of my previous research over the past few years, where I've been looking at Alzheimer's and Down syndrome and other inflammatory neurological diseases, and found that the trisomy 21, the Down syndrome, also has development of Alzheimer's by age 55 to 65 if the person with Down syndrome should live that long. So the common denominator is that they both would form the plaques, the tau tangles and the beta amyloid plaques, of which fibrin is a substantial component. Fibrin comes from fibrinogen. Fibrinogen level is normally 200 to 400 units on its scale. And if it's much above that, there is a very substantial prothrombotic situation that can cause massive clotting if there's a cytokine release and a hyperimmune response, sometimes referred to as a cytokine storm. So looking at the fibrinogen and then looking at what can control it, I found that the literature supports that vitamin D3, the active form of vitamin D, the level of that is inversely related to the level of fibrinogen. So if you're deficient in vitamin D3, your fibrinogen levels will be above normal and you'll have a prothrombotic condition. And I found the literature to support this with type 2 diabetes mellitus. I found this also with cardiovascular diseases, neurological diseases, asthma, immune thrombocytopenia purpura. Almost any of these diseases that involve an inflammatory component also are related substantially to a chronic vitamin D3 deficiency. Vitamin D3 it can be found from your diet. And if you have sun exposure, the vitamin D2 that's in your food that you consume can be converted to vitamin D3 if you have adequate sun exposure. The use of sunscreens will block that to a considerable extent. There are some medications that will interfere with the conversion of vitamin D2 to vitamin D3, including hydroxychloroquine. We've heard that mentioned in the news a number of times as a possible treatment. It may have other uses, but it does block the conversion of D2 to D3. Zinc, vitamin C, and other things are also important, but they don't correlate with the fibrinogen level. And the fibrinogen level being high and the vitamin D3 level being low is a very dangerous situation, and here's why. Vitamin D3, when it's at its normal levels, and that's another issue we'll talk about in a minute, vitamin D3 will stabilize the mast cells to keep them from releasing cytokines and becoming a cytokine storm. If vitamin D3 is deficient, then the mast cells are unstable and can degranulate and break up, releasing cytokines and causing a hyperimmune or cytokine storm response. So at the same time that vitamin D3 is low, fibrinogen level is high, and therefore you have a tremendous amount of raw material, the fibrinogen, which is also known as clotting factor 1. You have a large amount of this material just ready for being converted into fibrin and forming clots. So chronic vitamin D3 deficiency, while it causes all of these comorbid conditions, also sets you up for a cytokine storm if there is a release of cytokines, and it'll have tremendous intravascular clotting, clotting in the lungs. This can be clotting it could be a thrombotic problem with an organ. You could throw a clot to a kidney or your pancreas or some other organ and have significant organ damage. Vitamin D3 levels have been based on bone health. So the normal levels of perhaps 30 or 40 on that scale of which it's measured and reported is considered normal for bone health. And it's not necessarily the necessary level to avoid having elevated fibrinogen. And I've looked at the literature, and I've had to deduce that probably the best way to know that you have the correct vitamin D3 level is that your fibrinogen level is within range, mid-range of the 200 to 400 units on which it's measured and reported. Most of the people who are admitted to the hospital have if the fibrinogen level is measured, it's found to be 700 units or higher. And even if it's in the 500 range, it's still a substantial risk. Vitamin D3 levels are sometimes being measured now that there's more interest in vitamin D3. And some people have reported that if people are admitted to the hospital with low vitamin D3, their outcomes were more severe than people who came in with more normal levels. I would consider a more normal level until further research is done is probably being 60 to 80 units rather than in the 30 to 50 range on the vitamin D3 scale. Do you have any questions at this time, sir?
Anybody with a question? Any question regarding the research that Sir James has talked about in relation to the vitamin D3 and its levels and its the possibility that when someone has COVID and has low vitamin D3 levels, the condition is severe. Any question in regard to that? Okay, I think there's no question, so we can proceed.
Okay, so a number of hospitals around the world now are starting to do studies of vitamin D3 levels on admission and during treatment, as well as some are supplementing, sometimes with intramuscular or intravenous supplementation. The serum half-life of fibrinogen is reported to be 4 days, which is 96 hours. So if you would start to improve somebody's vitamin D3 level, you would anticipate that the fibrinogen level would go down by about half within those 4 days. So if you're at 700 and you have a target of 300, it would take 4 or 5 days of supplementation before you get to that level. People who are obese their fat cells disproportionately absorb the vitamin D3 from circulation. So it's difficult to restore vitamin D3 levels in somebody who is obese, and it's difficult to maintain them. So if you're trying to stabilize a person's vitamin D3 levels who comes in with significant COVID-19 problems of breathing and shortness of breath and blue lips, you certainly should consider the vitamin D3, at least testing whether or not you start to supplement immediately, or I would think get some baseline labs, perhaps give some supplementation, and then see what the labs reveal. Vitamin D3 testing typically requires the use of a mass spectrometer in the laboratory, and fibrinogen also has some difficulty being measured directly. So quite often there is a viscosity test that's used to infer the fibrinogen level from a scale of viscosity, the thickness of the serum. There are various medications which will help to control the whole process from once a person has been infected until they're symptomatic, if they become symptomatic. And in the early stage, if somebody were to raise their vitamin D3 levels, if they hadn't been taking a multiple vitamin or a vitamin D3 supplement, and if they were overweight, type 2 diabetes, asthmatic, cardiovascular disease, pregnant, if they have hair loss, those are all basis for a reasonable presumption that the person has chronic vitamin D3 deficiency. Now, in pregnant,
I have a question, sir. Sir James.
yes,
You talked of the vitamin D levels and you said that they can be tested in the lab, correct?
yeah, they can be tested in the lab. That's correct.
Yeah, so assume because we are now looking it in the aspect of in the African continent, some people may not have access to the lab testing tools and such kind of things. So is there a way that a person can tell that they have a deficiency of the vitamin D? Or
Yes.
yeah.
If the person, if a woman is pregnant, there is usually a vitamin D deficiency because of the extra metabolic demands. So that is one way of knowing that there's a vitamin D deficiency unless prenatal vitamins and such are given. If a person is overweight and obese, that's another indication of vitamin D3, chronic deficiency. Going along with obesity is the onset of adult onset diabetes, and that's considered type 2 diabetes mellitus. And that is the end result of people being obese. And what's very interesting is that a person's appetite when they're vitamin D3 deficient is hard to control. So people tend to eat a lot more because of the sensation of hunger when their vitamin D3 is deficient. So if they eat more, but they're not getting enough vitamin D3 because of what they're eating or not eating, then they gain weight. Then they develop the type 2 diabetes. And then with their obesity, it's difficult to treat the vitamin D3 level because their body fat wants to store it rather than make it available for use. A person who's had a stroke or a heart attack or Alzheimer's or some pulmonary fibrosis, any of these inflammatory disease diagnoses are correlated in the medical literature as being associated with chronic vitamin D3 deficiency, either as a causality or as a consequence. And certainly more information is needed, but there's enough information from all of these spectrums of cardiovascular, pulmonary, metabolic diseases that if there's inflammation involved, vitamin D3 is most probably to most certainly deficient and long-standing.
Thank you. Thank you. You can proceed.
Vitamin D3 is found either from supplementation in your food or vitamins. It's added to some milk products, but not to a very large extent. Vitamin D3 can come from mushrooms, and it can come from various fish oil or fish meat. The cod liver oil in the 1930s was used to cut down on the absenteeism at factories from people who had cold symptoms, cold and flu symptoms. And that was met with a considerable success, and the absenteeism was kept down with the cod liver oil. So most of the food we eat doesn't have much D3. You can also get it from a chicken egg, and you can get 40 international units. If you go by the scale by which they've recommended vitamin D3 level to be at 400 to 800 units, and they're looking at bone health. But if you look at that, let's say that we go with 400, that would still, if you were to, that's how much per day that you need to for your intake to get to the correct blood level. The 400 international units per day would be 10 chicken eggs if you were only going to get it from that source. From mushrooms, it would even be less. And from fish products, that's pretty good. People in Norway have enjoyed a lower, less severe outcomes with the moderate and severe COVID-19, and they consume a considerable amount of fish products, perhaps in comparison to some of their adjacent countries like Sweden. So probably the sun conversion of D2 from your foodstuffs by the sun on your skin will help when there's sun available and you're not using a sun blocker. And it also has to do with how fair-skinned a person might be. So there are a lot of factors, a lot of reasons why we're vitamin D3 deficient in general on a global basis. In Saudi Arabia, I understand they don't start their day until late in the day when the sun is down because it's too intense. And I suppose that's true in some places where the heat is high and the sun is intense during the height of the day. Do you have another question, sir?
Sorry, you talked of obesity being a deterrence to achieving the required levels of vitamin D3 in the body, correct?
Yes.
Okay, so if a person wants to attain the levels of the vitamin D3, apart from consuming the food that you have talked of, like fish, cod liver oil, and such kind of things, you insinuate that they need to exercise, and so that the body fat can be broken down. Is that
Exercise would be good. Some people are beyond the point where they can exercise to reduce their obesity if they're too large, if they have cardiovascular problems that have developed from the diabetes. Some people just simply can't exercise it away. So sometimes it has to be by reduction of foodstuffs and proper supplementation. Certainly exercise is a good thing, and it has to be adjusted to the person's metabolic demands and abilities. So it's always good to talk to your health advisor about an exercise program.
Okay.
Quick question.
Okay.
Okay. Hi, sir. This is Hans. I have a quick question. So, the Cardiologists Association had pretty much stated that working out, at least walking or exercising 30 minutes a day, can help to improve heart health. Can you elaborate on that further?
Exercise
in terms of obesity, in terms of at least exercising at least 30 minutes a day, even if it's just walking around or doing something active for 30 minutes a day.
Even walking or climbing stairs can be very difficult for a COVID-19 patient because of the inflammatory depositions in the lungs. So it shows how much energy it takes to walk. So yes, walking would be a very good exercise. Some people have a treadmill, but certainly walking is very energy demanding and would be recommended as long as the person doesn't have balance difficulties or balance difficulties would be an issue. But other than that, that would help to improve your cardiovascular system and help to burn up some of your body fat, release some of the vitamin D3 that's been absorbed into these fat tissues. Because if you have a large amount of fat, you have a tremendous amount of vitamin D3 stored in that fat, but it's not available for general use unless you start to exercise or diet with a lower number of calories, and then some of this vitamin D3 can be released back into your circulation.
Okay, thank you for that insight, sir. I appreciate it.
Thank you.
Mm-hmm.
So I was having this question. I was saying that, okay, let's assume that you're obese and you're not in a position to do the exercise. Does the increase of intake of foodstuffs containing vitamin D3, does it help you, or it is useless even if you increase the intake of the foods containing D3 vitamin?
Are you talking about somebody who's already substantially obese?
Yes, and you're not in a position to engage in physical exercise, but you really want to have vitamin D3.
Yeah, so if somebody's substantially obese, consuming foodstuffs to get their D3 or D2 would probably not be sufficient to bring their D3 level up and keep it sustained at a reasonable level to control this inflammatory situation, and wouldn't be substantial enough to keep the fibrinogen in the right range. So they probably need a supplement.
Okay, thank you so much. You can proceed, please.
Okay. There have been questions about whether or not the D3 supplementation would be toxic. And there's a general consensus that you can take higher levels of the D3 for short periods of time or even prolonged periods of time based on what it takes to get your D3 level within range. Now the range, again, I'll remind you, has been based on what they consider to be sufficient for bone health to avoid rickets. I sincerely believe that once new guidelines are established for immune health, that they will be substantially above those recommended for just bone health. If we think about the course of from infection through the various levels of possible presentation with COVID-19 from the SARS-CoV-2 virus, you can go from a dry cough or minimal symptoms where you may think you just have a cold with a sneeze and a sore throat, to being short of breath or profoundly fatigued with minimal exertion. It's handy if you have a little handheld device called a pulse oximeter to know if your oxygen level is in the high 90 range or in a range that is consistent with any pre-existing pulmonary problems that you might have. So if you have that device, then you can monitor and correlate those readings with how you're feeling. And if those pulse oximeter readings go down and continue to go down through the 90s into the high 80s, then you realize that you need to seek medical attention. If it fluctuates in the mid 90 range, then you probably, if you have COVID-19, probably have a very mild situation. Vitamin D3 is good for controlling this. If you're not allergic to aspirin, if you're not already on aspirin, if you don't have any reason not to take aspirin, then the 81 milligram aspirin can help prevent from having massive clotting. But there are some people who can't take aspirin for bleeding disorder reasons or because of allergic reasons. But aspirin is readily available and inexpensive and can be used when otherwise not a problem. Going from there, there are a lot of recommendations for other vitamins, vitamin K2, to help the vitamin D3 work better at certain biochemistry levels in the body. So both the vitamin K and the vitamin D3 are fat-soluble vitamins, and you can get the vitamin K from a variety of vegetables or from supplementation. If you get to a point where you're having more difficulty breathing and you can't climb the stairs, but you could before, you have no reason other than the onset of COVID-19, then your oxygen saturation values will probably be below 90, and you seek medical attention, get some advice as to what to do. Guaifenesin is found in some cough syrups or by itself as a tablet, Guaifenesin, guaifenesin, and that can help to break up the thick mucus in the lungs that has this fibrin in it, so that you will improve your oxygen carrying capability, and the numbers will come up higher on the pulse oximeter and you'll have more energy. If the ivermectin can also reduce fibrinogen levels, but it doesn't restore vitamin D3 level. I'm just trying to mention some of the other medications that have been in the news. Famotidine, which in the US is called Pepcid, has been reported to be able to interfere and reduce or block viral replication. The remdesivir has also been touted to do that, and there have been varying results on that. And the World Health Organization currently does not recommend the remdesivir in most situations. Remdesivir is still approved, and dexamethasone is still approved. Dexamethasone is indicated for moderate to severe COVID-19, not for the mild. So they don't recommend the corticosteroids for mild, but they would consider its use in moderate and definitely in the severe. Other medications that can be considered have to do with breaking up the clotting material, preventing the clotting. We really want to try to prevent the cytokine release. That's where you want to stabilize the mast cells. The mast cells can be stabilized with heparin. They can be stabilized with vitamin D3. Can be stabilized with the dexamethasone. And chromal and sodium is also a possibility for stabilizing the mast cells. So if you can prevent the cytokine release, you really keep this from getting out of control, and you keep it from having substantial coagulation problems and clotting. And it would appear that those people who have gone through the COVID-19 and survived, but have prolonged tiredness and fatigue and a wide range of symptoms, and they're not feeling well for days, weeks, and months afterwards, it would seem as though their vitamin D3 wasn't corrected or wasn't addressed, but they made it through the worst part of their disease, but that they've ended up with clotting disorders. And it's been found that people who are the long haulers, people who have the prolonged symptoms and lack of energy and depression and all of these problems following their worst part of the disease, they've been found to have blood clots in their legs, they've had strokes, they've had heart attacks. Women are having difficulty with more clotting and bleeding irregularities with their monthly cycle. So there seems to be considerable ongoing coagulopathy problems after a person has gone through moderate or severe COVID-19. So we really want to try to keep it from getting beyond mild. And I would suggest that vitamin D3 levels, if they're adjusted and sufficient, will keep a number of people from getting the moderate to severe. There are some hereditary conditions. It's not clear exactly what is best there, because a lot of those things you don't know. If somebody's been admitted to the hospital, you don't know if they have DiGeorge syndrome, where they don't have a thymus. You don't know if their chromosome number 3 is one of those more ancient ones that is weak. And if a person has Down syndrome, you can usually tell that by clinical observation. The Down syndrome people have considerable difficulty with this COVID-19. And that extra chromosome apparently makes more clotting factors and makes it more difficult to avoid the blood clotting. Do you have an additional question, sir?
Anybody from the audience with a question before I ask mine? Any question from the audience, please? Okay, so I have my question, and I believe also the rest will be in a position to learn from the questions that we're asking. So my question is that you have talked of some of the treatments that being undertaken for COVID-19 patients. You have talked of remdesivir, remdesivir, and also you have said that stabilizing muscles, breaking up clotting, and you also mentioned, I think, aspirin.
Yes.
Yeah. So my question is, here in Africa, what we are really, we have the herbal medicine. So I don't know whether you have anything to say about the herbal medicine. I don't know whether you know garlic. We are,
Oh, yes. Yeah, yes.
yeah.
Thank you for mentioning garlic. Garlic can help to break up these fibrinogen deposits and can help prevent from having more clotting occurring. And this is definitely recommended in people with cardiovascular disease. A lot of people are told to eat the garlic and also take the 81 milligram aspirin if they're not allergic to it or don't have some other reason they can't take it. And this helps improve the circulation and your physical endurance. So the garlic is very important. Absolutely.
Okay, thank you. I have another question also regarding to that. You talked of the signs of COVID-19 and you talked of dry cough. You talked of shortness in breath or shortness
Yes.
of breath. You also talked of fatigue. Um, could you, because I understand that also these are symptoms for other diseases. So how do you clearly, are there symptoms which can clearly point out that this is COVID-19? Is there that one sign which clearly points out that this is COVID-19?
There are two suggestions I can make. If you have the pulse oximeter device that clips on your finger, you can tell from the low oxygen level that you probably have it. If you don't have that, if you have extreme fatigue that you can't explain, and it's in the context of being exposed to this COVID-19, you've been around people who have had it, and now you seem to have, you can't even get out of a chair. You can't walk across the room without gasping for breath. You can't even think about climbing stairs. It's pretty clear that you have the COVID-19. That distinguishes it from a common cold where you're going to have a sneeze, a cough, a sore throat. Also, people with COVID-19, their voice changes because their vocal cords get coated with fibrin. So it changes the way they speak for a while it's the vocal cords are coated. Also, they'll lose their sense of smell and taste quite frequently. About 85% of the people with the COVID lose smell and taste right away.
Thank you. That is helpful. Thank you. You can proceed. If we don't have any other question from the other participants, anybody with a question?
What about zinc? I've not heard us mention that. How does that help with COVID-19 and stuff like that?
Yeah, the zinc is a cofactor that we need for a number of biochemical processes, and people can be chronically low on zinc. If you take a multiple vitamin that contains zinc, that's probably a sufficient amount. I don't think that large quantities of zinc are going to be helpful in any way. You might not experience any side effect from taking too much, but I think beyond just restoring a normal level is probably unnecessary. It's different than the vitamin D3, where if you're substantially obese, it's going to be difficult to get the level up and keep it up.
Thank you for that input. Thank you, sir.
Thank you.
Ibrahim, you have a question? I can see you have unmuted yourself. We can't hear you. We can't hear you. So speak up, please. Yes.
Yeah. The question with the question that I'm going to ask is that how long does it take corrective indeed close Sir has analyzed with the vitamin D issue. So the first question with regard to the issue as analyzed it, how long does it take to correct a vitamin D deficiency? The second question is also relevant to the vitamin D. Does vitamin D reduce bile fat? This is the second question. The third question that I would like to ask is that to the issue as analyzed with COVID, a potential role for vitamin B in COVID-19. Thank you.
Mr. James, have you had the question or should he repeat?
Why don't you repeat one at a time, and I'll answer them one at a time.
Okay, Ibrahim, one question at a time, please. The first one.
First one is that how long does it take to correct a vitamin D deficiency?
How long does it take?
How long? It depends on the person's amount of fat. It depends on how low that it is, and depends on if they have other illnesses that may cause more demand on the vitamin D3. But in order to bring it up, you'd have to take more than the normal daily dose for a period of weeks. A number of people have cited very differing suggested amounts to take, but it would not be unreasonable to take 1,000, 2,000, or 4,000 milligrams, or not milligrams, but international units, IUs, per day. But at some point, either you need to have that tested, or you have to revert back to more normal recommendations until these recommendations have been refined, now that we know that there's a greater demand for the immune system rather than just bone health. So the answer is you probably need to take 1,000 to 4,000 international units a day for an adult for a number of weeks to make a difference.
So, thank you, sir. The second question that I would like to ask is that
I can't hear.
does vitamin D...
Ibrahim, we can't hear you. We can't hear you.
Can you hear me now?
Yes.
Yeah, the question is that does vitamin D reduce belly fat?
Belly fat? Yes.
Yeah. How?
The vitamin D3 curbs your appetite. If you are vitamin D3 deficient, your appetite is hard to satisfy and you tend to snack all day long. So it helps by curbing your appetite. And then if you have your normal amount of activity or a little bit of extra exercise, your belly fat will start to melt away. It's not a direct effect, it's an indirect by curbing appetite in a safe way.
Oh, thank you. If we get COVID,
I can't hear.
what's the potential role of vitamin B in a COVID-19?
What's the potential role of vitamin D3 in COVID-19? Is that your question? If I understood the question correctly, how would vitamin D3 help with COVID-19? It would reduce fibrinogen levels and stabilize the mast cells to help to avoid release of cytokines and that hyperimmune response, sometimes called cytokine storm, which causes all the clotting. So that's how it would help, is by two different ways. One, to stabilize the mast cells so they don't degranulate, break up, and cause a storm. And two, bringing down the fibrinogen level so there's not a massive amount of raw material for blood clots. So it helps in two ways. So it's very important.
Okay, thank you. Thank you so much. I can see Madam Aminia Lassamdan now as her hand raised up. So, Madam Ming, the floor is yours. Yeah.
I'll mute.
Madam Ming. Madam Ming, we can't hear you. Madam Ming, please unmute yourself. I can see you are still muted. Yeah. We can't hear you. Okay, I think she's having some technical problems. So any other question? As she works on a network or maybe connection, probably.
Maybe she has problem technically.
Yeah. So we can proceed. We can proceed if there is no other question. I don't know how many minutes you are remaining with, but you have all the time. So just proceed, sir. Please unmute yourself.
I just did.
Okay.
Okay. Let me talk a little bit about the problem that can occur in pregnancy. In pregnancy, if the woman is not obese and does not use nicotine and is not diabetic, her fibrinogen level increases throughout pregnancy because at delivery, when the placenta separates from the uterus, the fibrinogen is available to keep from having excess bleeding. However, in a woman who is obese, uses nicotine, and or has type 2 diabetes, the fibrinogen level gets too high, and that causes a condition known as preeclampsia, or can go on further to eclampsia. And this is where there's extremely high blood pressure and a stroke or coma can occur from this extremely high fibrinogen level, this protein level in the blood. So women who are obese or use nicotine or have type 2 diabetes and who are pregnant should be considered complicated obstetrics, and that should be associated with a periodic check of the vitamin D3 level to be sure that it's adequate, so that the fibrinogen level, which is inversely related to the vitamin D3, doesn't go too high. On a different topic, the vitamin D3 can also help to avoid a situation where platelets are consumed too quickly. There have been some recent reports in the news of a rare event where a person's had a vaccine and they've had bruising and bleeding, and their platelets aren't functioning, and their platelets are being consumed. This is called immune thrombocytopenia purpura, and ITP, and it's also like the idiopathic thrombocytopenia purpura. It's a loss of function and or the count of the platelet count. And platelets are important to prevent bleeding, but they're also consumed considerably in the COVID-19 with the cytokine release. The coagulation system and the immune systems are extremely interrelated. They're really a more complex system overall, but we look at them as two separate systems. The vitamin D3 is helpful. The receptor for vitamin D3 is found practically on every type of cell in the body. So if you have a vitamin D3 deficiency, it really impacts all of your systems. And if it's a chronic problem and you have this elevated fibrinogen, then you're going to be more apt to have fibrin deposits, such as the Alzheimer's, the plaques, with the cardiovascular, people can end up with atrial fibrillation where the heart doesn't beat strong, but the normal pacemaker is erratic. And that is also directly linked to high fibrinogen and low vitamin D3 levels. Do you have another question, sir?
Yes, there's a question from Madam Ming. She has written it down. She's saying that on traditional medicine, please discuss shortly the relevance of STEAM in addressing concerns on colds. I guess, yeah, STEAM, the essence of STEAM in curbing, in addressing the relevance of STEAM in addressing concerns on colds.
Are you talking about steam, hot
Yes.
air?
Yes.
Okay.
STEAM.
Yes. Yes. Steam is very helpful because you have to keep the airways and lungs moist so that this very thick mucus can break up and clear itself from the lungs. If you're in an area where it is dry, this all turns to thick glue and it's not moving, and it'll be very hard to help that person if they're not properly hydrated. So they need good hydration orally or intravenously if they can't take it orally, but also the steam would be very beneficial to help moisten the airways so that the thick secretions in the airways and the lungs have a good opportunity to break up and come up. Now, sometimes you don't even notice when it's coming up. You just feel like you need to swallow. And other times you notice something comes up that you need to spit it out.
Okay. Anybody with another question?
Okay.
Anybody with a question? Jacqueline Joroge, do you have a question? Yes, Ibrahim, you are talking. Ibrahim, you have a question?
Hello.
Yes.
Evening.
Good evening to you.
Thank you very much. My name is Mohammed Adam from Somalia. I congratulate how well nicely have been explained by health promoting Master James. I also thankfully for other colleagues and participants. So I have a small question, and my question is that as in 2020, COVID-19 had erupted at the mid of 2019. At present, there's no any preventive measurement that the globe, was, especially the developing nations, has produced. So when we are talking about health promotions, like this disease, COVID-19, and similar diseases, do we have a specific measurement on treatment that we can and vaccine to the to the people, or we have only health promotions that some prevention is to like and when somebody is sneezing, when somebody is having a cough, to prevent. So, or we have, and especially what we are talking about, big governments and big NGOs like and UN agencies like WHO. So, is there any measurement, or is there any specific treatments that we can have, like COVID-19? Thank you.
At the present time, the only things that are quote unquote approved for treatment are remdesivir and dexamethasone. Both of those are out of reach of the person on the street who would have to see a healthcare provider for those. The guaifenesin can be purchased in tablet form or in a cough syrup form over the counter. And that would be good to keep the mucus broken up in the lungs when you have that dry cough. The dry cough is dry and not productive because things are sticking together too much in the lungs. So it would be good to use the guaifenesin, the vitamin D supplementation, and probably a multiple vitamin with the zinc and the C and all of this would be a very reasonable recommendation. As far as if somebody's obese, if they can cut back on their intake a bit, and if they can exercise a bit more, if they're able to do that, that's fine. But people quickly get fatigued when they can't get sufficient oxygen. They also get anxious and irritable and depressed. The vitamin D3 can help with the depression. It can help with the lowering of the fibrinogen. It can help to stabilize the mast cells. And the chance of being overdosed on vitamin D3 is extremely rare. I mean, in this situation, we're not talking about anything that you could buy at the store that would cause an overdose.
Okay.
Thank you.
Now,
Thank you very much.
if you can eat more fish, if you can eat mushrooms, if you can get the vitamin D3 supplements, those are all good. Other things that raise fibrinogen are cigarette smoking and the diabetes. So you want to have that diabetes under control.
Okay.
It will be great. It will be great. Thank you. It will be great. Thank you a lot.
Thank you. You're welcome.
Okay, I have a question on regard to honey. We have been including honey in our concoction, our traditional concoction, that is ginger and lemon and honey. Does honey have a role to play in the COVID treatment of COVID?
You're asking about ginger and lemon and honey. Is that correct?
Now, you talked about ginger. You already responded on ginger. Now, what I'm inquiring is to know whether the addition of honey, whether it adds any value.
Did you say honey?
Yes, honey.
Honey. Yeah, the honey would be would help somewhat coat the throat a little bit because this virus can attack the lining of the mucus lining of your throat, and if you have tonsils or your airway. So the honey in the throat, also gargling. If you've been around people where you suspect they have COVID, the use of gargle, even saltwater gargle, would be recommended. But the honey could help with in the oropharynx region.
Okay, thank you. Anybody with a question from the audience? I would like to remind you that Sir James is one of the greatest speakers that we can have, and is best suited to talk about COVID because he really has specialized in the medical field. He has a master's in chemistry from Illinois State University. Also, he has studied medicine in Chicago Medical School. So he's the best person to discuss to us about COVID-19. So if you have any question, these opportunities don't just knock every day. You really need to ask that question which you have been preserving, or to allay any form of misinformation that you may have had previously on COVID. So anybody with a question, this is the right time to ask.
Yeah, Master, thank you very much. For me, I don't have any question, but I have one suggestion, if it's possible. As I said before, we specifically Somalia, we would like having such discussions on health promotions and also many different aspects of, because very soon we have this advanced technology which we can share many different things. So we would like that one day African should be a great development. So thank you very much. I think you will in touch with us shortly while you have such programs whatsoever. Thank you very much.
Thank you. Welcome.
Thank you. Thank you.
Okay. So I don't know how much time you have. If you could just proceed, and once you are done, then you have all the time. So you have no
Okay.
limit.
All
Just
right,
be
let me
short.
talk, unless you have other questions, I'll talk a little bit about some of the other treatments that are being given in various hospitals around the world. They talk about convalescent serum or monoclonal antibody treatments. Uh, these type of treatments are expensive and require hospitalization generally and are not widely available to the masses of people, but they can be very helpful. You have a question there, please?
Yes, I have a question. The question that I'm going to ask is that are the people with underlying health conditions more at the risk of getting COVID-19?
The people who are caring for those with COVID-19 have day-to-day exposure. So that's why the masks and the hand washing is so important. But it is true that a number of healthcare providers have gotten sick with the COVID-19, whether it's from treating with the patients or other sources isn't clear. But the COVID-19, the virus SARS-CoV-2 is contagious. It is infectious, and it's easy to acquire.
Okay, I guess you can proceed.
So people on allied health, if they have pre-existing asthma or type 2 diabetes, or they're very overweight, they probably should not be at the front line of the medical treatment. They probably should take a more distant role from that, because they're at higher risk.
I have also a question with COVID. Does new variant COVID from the UK cause much as of the previous?
Mr. Moderator, could you repeat the question, please? I couldn't hear it.
Yeah, the question is that the new variant of COVID from the UK cause much as the previous COVID.
It's breaking up so much. You're talking about the UK. Are you talking about a vaccine?
He is talking about
No, the question is,
the new
let me,
variant.
Oh, the
sorry.
new strain. Yeah, the new strains seem to be easier to catch. They don't necessarily mean that your disease would be worse, but if it's easier to catch, then more people who are susceptible because, the other risk factor is older age, because the number of your T cells is decreasing with age, because your thymus gland, which you're born with, shuts down about age 16, and then the rest of the T cells come from your liver or bone, and they're not as abundant with older age. So older age can be a risk factor in and of itself, although some people 100 years old have had this and they survived it. So the risk factors are complex. We don't understand everything. But these new viral strains are concerned to the scientists, and they're concerned to the vaccine manufacturers, because they don't know if it's a good enough match to be helpful, but I do believe that they will be helpful. So I recommend the vaccine if it's available. It would also be a good idea to take some vitamin D3 ahead of the vaccine, just for safe measure.
Yeah, I have a question on regard to, I understand, Ibrahim, your question has been answered satisfactorily. Okay, I asked my question. I can't hear whatever he's saying. he has a problem with connection. So my question is, you have talked of the vaccine. We have had
Yes.
so many vaccines which are being approved, and there are those, we have the theories. I don't know whether they are true or not, and they are really scary, whereby people are being told that, I don't know, this vaccine has this and this and this. It is to control, I don't know, population or something of that kind. And on top of that, it has really proved to be difficult for the vaccines to, we have been told even it may take a year for a vaccine to reach in some of the third world countries, the developing countries. So what is your take on the vaccine? Because now the vaccine, we have several vaccines which have been approved, but they are not readily available for some countries, because remember that they are being bought. Governments have to buy for their people. And some governments are really not in a position to do that, especially in Africa. So what's your take? Because we are not assured of the vaccine reaching us anytime soon. So should we just continue with the precautionary measures that you have talked about, and also working on the D3 vitamin, or what should we do?
Well, I'm glad you asked that question. The reason that I've spent this whole past year studying this and talking about it and writing about it is because until that we treat the last person, we haven't treated anybody. And I'm fully aware that many countries don't have the financial resources to buy the vaccines or do some of these things or do all these fancy hospital things. So I've tried to work to find things that are available, that are affordable, and can help to treat the symptoms and hopefully pull the people through, because we hope and pray that the vaccines will work. Some of these technologies are brand new, and nobody has all the answers. We'll see as we go. We believe that they put their best effort and best science into these, and I support any vaccine that is safe, effective, and will give you some prolonged immunity. But even in the United States, where they've distributed millions of doses, they haven't been administered because they don't have enough people to administer. Some people are reluctant to be first in line. There are just many questions. You've raised good questions, but I support them. And I'm also at the same time trying to have in parallel a complementary program with diet, exercise, and what I would call holistic or integrative medicine, where we use what we have available, use all the best knowledge that we have. As you mentioned, garlic. This is one thing that's very important. Some people would not think much of that, but it is important. So there are a lot of things that can be done, and you have to do it with the resources that you have. So if you get the vaccines available, that's great. And in the meantime, these other recommendations that I'm making are based on my very best efforts and my education, training, and experience.
Thank you so much.
Well,
I can see we have
I have question.
Ibrahim. A minute,
Yes,
please.
I have
We have
question.
a minute, please. We have Fabian from Gambia who has a question. She's an health expert from Gambia, so I believe she has a question or something. She has a hand raised up.
Good.
Fabian.
Good
yeah.
evening. Thank you very much.
Okay.
Concerning what Ms. James have just mentioned concerning the vaccine, I would like if he can just tell us what are the expectations from the vaccination, because we have seen that people have started taking the vaccines and some have experienced some side effects. So what are the side effects that people could expect when taking the vaccination?
Well, the normal side effects that people would get would be some tiredness, some soreness, maybe a little bit of a fever. They might have to plan to rest for a day or two, and that should be all it is in the normal situation. There are people who maybe have a response where they start to have an allergy, so that somebody who has given them the vaccine has to give them the antihistamine or the epinephrine or something to stop that allergic reaction. Allergic reactions do occur with any type of vaccine. I have no reason to believe that these vaccines will be better or worse in that regard. I do support their use in development and distribution. I just see that it's going to be a slow rollout. Not everybody's going to have the money for them. In the countries that don't get the vaccines or don't get them right away, if people continue to travel the world, then this disease, as it mutates, will just get cycled back and forth. So I'm looking to see what can be done simultaneously throughout the globe to treat everybody every day. And I'm trying to do it at a level that's affordable and available and sustainable.
Yeah, because like people are being scared now about this vaccination because the expression what they have been given concerning this vaccination, especially in Africa. We've seen that like people in the Europe or the US, they've started encountering some challenges with this vaccine. So do you think the third world, like in Africa, they are skeptical even to receive this? Though we need it, but people are skeptical because of the side effects that people are
everybody should be as aware and informed as they can about any vaccine that they get. I have no reason to believe that these vaccines are any less safe. They just haven't been tested as long as they normally do. They normally test vaccines over a period of years and in a wider audience.
Okay, thank you for that.
Yeah. And I don't own any stock in any drug companies either.
Right. We just want to hear from you based on like the scientific background.
All of what I'm giving to you is pure science and my very best effort at presenting it and answering it.
Right. Thanks.
Thank you so much. Any other question? Ibrahim, you were asking something before interrupting.
Yeah. Question.
You are breaking. You are breaking.
Question. So,
Ibrahim, we can't hear you. We can barely hear whatever you are saying. You need to check your network.
Can you hear me? So the question is that what is mean that
We can't hear you. We can't hear you, Ibrahim. So let's proceed, please. Check on your network and then come up again, please.
You want me to go ahead and continue talking? You have another question available?
Yes.
Any questions from the audience? Yeah, Joseph Mwania. Yes, Joseph Mwania, go ahead.
Mine is concerning on the line of the vaccine.
Go ahead.
Yes, can you hear me?
Yeah, go ahead, please.
On the line of the vaccine, we have encountered cases in the UK of some sort of mutation of the virus. I know
yes.
about the lockdown that is going on in the UK. In December, there were speculations that the new mutation, the new strain, that what is being termed as the second strain of COVID-19, has perhaps reached India. So, how does considering the fact that we have just realized a vaccine for the first strain of COVID, and now we are having cases of mutation. How does that even affect the milestone of realizing the vaccine in the first place? If I'm vaccinated against COVID-19, and then I encounter the mutated version of COVID-19, am I still vulnerable?
Okay, you ready for my answer? As the virus mutates, The vaccines will become either a little more, or a little less effective. But even if somebody were to get a vaccine for mumps, it improves your T cell function and it would help you. So just because the vaccine that's developed doesn't quite match the mutation, it substantially matches the mutation and will still provide protection as much as if it were completely tailored to the new mutation.
A quick one, another quick one.
Okay, go ahead. Go ahead, please.
Yes, I'm saying there's a time when COVID started, there was a medical.
You are breaking. We can barely hear you.
I'm saying when COVID started, in Kenya, there was a discussion about adding. And someone suggested that maybe we progress, herd immunity could be the way. What is your take on herd immunity?
Herd immunity. You are talking of herd immunity or herd immunity? What is, come out clearly, please? I guess he's talking.
HERD, I think he.
Mm-hmm.
I'm speaking about the immunity,
Mm-hmm.
whereby majority of the population perhaps contracts and heals. So in a group of 5, if 4 people have healed from have already experienced the disease and heals, they somehow protects the other one. So there was that discussion by someone from AMREF where they said going forward, herd immunity could be the thing.
Oh, you're talking about herd immunity. Herd immunity, HERD. Yeah, that herd immunity is an expression that was developed to talk about when you give vaccines to enough of the percentage of the population that would be exposed to the virus, that you don't have to get to 100% of the people because once you get to 60 or 70%, the transmission across the population is so remote that you're going to run into somebody. And it's whether or not the vaccine causes a sterilization of your breath, not your body, but your breath. Now, if you get a vaccine and you breathe in the virus, but you don't breathe it out, then you're not infectious. But they don't know if this is going to sterilize your breathing. So it's not clear whether herd immunity would be reached. And also you'd have to have everybody on the planet vaccinated about the same time, and that clearly isn't happening. If you just let people be exposed and develop immunity if they don't die, that isn't acceptable because it would impact too many people. So that's why the hand washing and the masks and the distancing are important right now, and as we figure this out. And this is why I'm trying to help open things up by finding sensible things that are affordable and available that people can do to improve their baseline health so that they're not as impacted by the exposure to this virus. This has been my goal. I'm not saying the vaccines aren't important, but they're not available everywhere. And even where they're available, not everybody's getting them.
Sorry for that.
So right now people are sick and dying, so that's why I'm trying to help. That's my goal, and I have no financial interest in this whatsoever.
I have a question, Sir James. Oh, can you hear me?
Yes,
Yes.
sir.
My question is what are common side effects of COVID-19 vaccine?
You're cutting out. You're blanking out.
The question is common side of COVID vaccine.
Common side effects? Was that the question?
COVID-19 vaccine.
Yes. You're asking about common side effects of the vaccine? Is that your question?
Yeah. Yeah.
Can you help me, Mr. Moderator?
Yes, he is asking about the common science, and I think Madam Fabian had asked the same question, and you had tackled earlier.
Yeah, yes.
I think the participant can use text message. Thank you.
Okay. So, Ibrahim had also asked another question in writing. He had asked, let me read out, about what we mean by adaptive immune system. Is it the same that you had answered concerning the herd immunity?
Well, there's an innate immunity and an adaptive immunity, and the adaptive immunity has to do with exposure, whether it's from whatever source.
Okay.
Those are important on a scientific basis, but not really to the person in the general population. Those concepts are kind of just more detailed.
Okay.
So your innate immunity, you have T cells and B cells if you're born with a good immune system. If your immune system is impaired by disease or by age, then whatever can be done to bolster your immune system, either with a vitamin D3 or a vaccine, will help you a bit. And as far as adapting to different viruses and things, you hope that you make a good antibody response. You hope that your B and T cell memory cells are helpful. I think there's a question coming in, so I'll stop talking for a second.
Okay. So, Madam Fabian, I can see your hand is still up. Is it a fresh or it is the initial one? You have something to say?
Something to say.
Can I speak?
No.
Madam, a minute, Ibrahim, a minute. Madam Fabian, your hand is still up. Do you have something to say?
Oh, no. Oh, I have to remove it. I have to just lower it down.
Okay.
Yeah.
So, Ibrahim. But Ibrahim, I prefer that you write your question because you seem to have problem with internet connection. You can write your question and I will read it out.
Okay.
Maurice,
Joseph
I have a question.
Joseph Mwanya, go ahead.
Yes, James. There's something that I did not catch when I didn't catch when you were answering my question. You spoke about making people understand their baseline health. Something I didn't catch. It's something that you say.
Sorry for that. Proceed, Mwanya.
Heard something.
Yes, I was saying about something about around baseline health that I didn't grasp well. I don't know if he minds repeating the same. I wanted to get what he's trying to do because he said there's something that he's trying to do, considering that this vaccine will not reach especially the developing countries in time. So
Yeah.
you say
what I'm trying to accomplish is to have not a plan B, but a complementary plan with the vaccine, whether or not it appears, so that you can do something today and tomorrow and the next day, because you might not see a vaccine soon.
yes.
Or the vaccines may have to go under redevelopment and there may be delays. So I'm trying to figure out with what you have, what you can do to make your health the best and to minimize the exposure and the extent of infection and the extent of outcome, negative outcome to this SARS-CoV-2.
Which I think it's a way to go. I really appreciate what you're doing.
I'm not saying that this takes the place of the vaccine, but the vaccine isn't. You don't have that as an option right now, basically.
We have to be cognitive of the fact that
even with the availability of the vaccine, it will still, especially with developing countries, my country factored in. If you look at how the management of the first case, then somewhere it became a personal responsibility for you to seek treatment, which is quoted in crazy figures. So even the vaccine, I see it going the same lane. So what you try to do, I'm so much impressed that someone is sitting down and looking for an option B to help people. So I think you should also get more like-minded people like you to the table, and you actualize your idea.
We're doing what we can do. There aren't too many people who will raise their hand like I do because they work for somebody who says don't say anything.
Yes.
For whatever reason. I'm not going to get into that. But so many people have some of this information, but they weren't the boy in the classroom raising the hand. I always was. So if I can help, I'm going to help. And I'm not going to say anything that isn't true.
No, I understand.
Okay, thank you so much. Any other question from the audience, please? If you have internet connection, you can just write your internet connection problems. You can just write your question and I will read it to our speaker. Remember that I'm telling you that this is a rare opportunity. He's an experienced person in the field of medicine, having studied in some of the best universities, and he is practicing that. So let's make use of that. Any question? You can write your question and then I'll just read it aloud without any other question. I think.
Yeah, Mariko?
Yes, sir.
Yeah, Cyril has a question that just logged in.
Oh, yeah, I
His
can
hand
see
is
Cyril
raised.
as his hand raised up. So Cyril, please.
Thank you, sir, for presenting. So my question is, you're bringing awareness to COVID in the African community. So what is the best steps that we could take to stop the spread of COVID in our community, since we're very much a relational community? So how can we avoid that, such as social distances? What are your suggestions, sir?
All of these things that they talk about with the social distancing and hand washing and the mask and all of these things, they work to an extent. They're helpful. We want to minimize the exposure to people who, if you know somebody has this, then they should, I don't know what the right word is, but they should be isolated at home and cared for and not out spreading it about. If you're in a community where there are many, many people and there's a high density area like Hong Kong or New York City or Los Angeles, the population density is so high, no matter where you go, it's in the air. So the best thing you can do is improve your baseline health. And I'm recommending the vitamin D3 as a very key factor that's quite deficient in many people. And by improving the intake of that and avoiding overeating, and if you have a diabetes, to be sure that it's in control, those are very important. Anybody with a pre-existing, what they call comorbid condition, is very much at risk of this and not doing well. And they can help themselves with the vitamin D3, the zinc, the vitamin C. And we've gone through what these various sources of the vitamin D would be. The fish, the mushrooms, the cod liver oil, the supplementations. You can get it from meat. The amounts are not very large in a person's diet. And the dietary portion can only become the active D3 if there's adequate sunlight exposure. Oh, and that earlier comment about the use of steam is a good idea. If you're in an area where it's really dry, it's important to stay well hydrated, or this dry cough will never clear.
Okay, I can see Fabian has a hand raised up.
Yeah, thanks again. Concerning what Mr. Loom Sarah just mentioned concerning the social distance in Africa, especially in the Gambia, I had a talk show today concerning COVID, especially the second wave, to change people's attitudes concerning social distance. It's going to be very difficult for us in Africa because there is a survey that one of my colleagues just did a research, and it's online. We spoke about the perception and behavior concerning COVID-19 amongst adults in our country. But whatever happens in the Gambia is happening in other African countries as well. So social distance is a big issue because people cannot abide with that. But what we keep on doing is more advocacy, sensitization about this COVID restriction. We are in washing of hands, wearing a face mask. It's difficult to change people's attitude because it's
Absolutely.
difficult. People are not used to it. So coming up with
Absolutely.
a new norm is really a concern for us, especially in Africa. People, they don't care, understand some of them. So we keep on doing sensitization about this COVID, washing of hands, wearing a face mask. So we keep on doing that advocacy as it goes on. So I just wanted to make this contribution for Mr. Loom, especially in Africa.
There are many places on the planet where this is not something people want to cooperate with.
Sure. So
this is why I'm trying to improve everybody's health by getting everybody to do as much as they can to improve their baseline health so that these people who don't cooperate aren't going to cause your sickness or death.
So any other
I hope these vaccines come out and I hope they're available. I hope they work. But in the meantime, we're losing people and we need to do something. And that's where my focus is.
Okay, there is another question from Madam Armenia. What is your stance on fear-based mechanism versus scientific-based mechanism on COVID-19? I repeat, what is your stance on fear-based mechanism versus scientific-based mechanism on COVID-19?
I think I can perceive the difference, but the person who doesn't have the scientific background probably can't determine, is this scientific or is this fear-mongering? So I would say that people need to pay attention to what people say and look for things that are sensible and reasonable and understandable. And that's the way I try to present things. I don't try to talk in fancy terms that could not be understood. But people have got to put their faith somewhere. They got to put their trust somewhere. So they should put their trust in science, and hopefully that the information they get is the best available at the time. And as it changes, they'll get an update.
Okay, thank you. I think you have answered that satisfactorily. Any other question from the audience? Any question? I said you can write your question and you can raise your hand. Okay, I can see Joseph Mwania as his hand raised up. Please, Joseph, go on.
Now, my take is on behavioral change communication, which I think it's what is lacking in the whole address of this COVID thing, because people are aware, have been made aware of the disease. They already have the knowledge, but they don't pass what we call the contemplation stage. Do you have maybe perhaps some behavioral change communication models that have worked on your side in your experience in the health?
How do we convince people against their will?
Yes, because exactly what I understand is people are already aware. They have already been made aware. They already have the knowledge.
Well, there are two knowledge bases. There are people who are too concerned about civil rights, and there are people who are too concerned about the science. And
Yes.
if you're going to demand your rights, and I don't want to wear a mask and I don't want to cooperate, it's not helping the end game. Unfortunately, the end game isn't anywhere, we're not close to the end of this. We're 1 year into it. We'd like it to wrap up as quickly as possible. We need to try to get people to be more cooperative and care about one another. I don't know what will do that unless they have a personal tragedy with this, and maybe they'll get a wake up.
So exactly, if we were to address the whole issue, we have to address the knowledge point where we have to get where everyone's knowledge aligns to the end goal, which is doing away with COVID-19.
And we need to get it under control. It's going to be one of the many viruses that will stay within our system. There are a number of viruses that float around and pop up on an annual basis here and there. And unfortunately, some variation of this, some mutant strain of this will continue to make its rounds. So we have to figure out how to get our bodies strong enough and healthy enough to be able to deal with this.
Okay, thanks.
Okay, another question from the audience. You can raise your hand up. I will see it in the chat in the participants room. You can also write your question and I'll read it aloud. So, Amenia, madam. You have something to say? I can see you have unmuted yourself. Madam Ming. Okay, so as we can proceed. Sir James, you can proceed. We can't hear you, sir. You will have to unmute yourself if you are talking.
Okay, unmuted.
Okay.
This virus, this SARS-CoV-2, it will continue to mutate. The vaccines should be, they should work. The mutations will continue, just like the common cold viruses, where we haven't had vaccines in the past, mutated so much that it didn't. But the problem is that there's a distinction. The old common cold wasn't this severe a disease. It didn't have this second stage with this cytokine release and cytokine storm and all this clotting and all these problems. A cold was a cold. This is a cold virus, but it's got teeth and claws. It's not going away right away, and a lot of people aren't cooperating because they don't understand it's a serious business. We, as a global population, we're vitamin D3 deficient. It means that our clotting factor, fibrinogen, is very high. We're susceptible to a bad outcome with this, depending on exposure and depending on our own levels of D3 and fibrinogen and general health and our genetics. So we have to become more knowledgeable, we have to communicate better, and we have to take best care of our health.
Can you hear me? I have a question.
Go ahead, please.
Last month, I have written an article that I was analyzed by the vaccine. So the question is that the vaccine will be the new diplomacy in competition of this space. So the world poorest governments, most of them, they could no longer tackle out that vaccine. So how long it will cause problem to the world in terms of justice? Though some government, they are strong enough in terms of economy, while others, they are weak. So how it could be matched, though it is a global health problem?
Would you pardon your question, please?
The question is that the vaccine will be the new diplomacy in competitions among the governments around the globe. So those who are enough financially, they can have solution to their population about the vaccine issue. So how it could be helped to those nations that can no longer solve the problems?
Okay,
We
okay.
have to, we have to do it. We have to go forward, whether or not the vaccine appears, whether or not the vaccine is going to work, whether or not the vaccine exists. But we hope that it'll be available. We'll hope that people will use it, and we'll hope that it'll give long-lasting help. But in the meantime, too many people are sick and dying. So we have to proceed as though we have to do it with what's here. It's like the old expression, when you go to war, you take the army you have, not the one you want. You have to do it, you have to make do with what you have. I'm trying to help that.
Any other question? Jacqueline Joroge, I can see you have unmuted yourself. You have a question?
Yes, my name is John Lum. My question.
Okay, Jacqueline, go ahead, please. John Loom, please, hold on the line. Jacqueline?
Okay, my question is, at some point last year, December, come 2021, there was a picture circulating that the COVID-19 vaccine has caused one of the patients to go savage and transform into a cannibal and injure most of the patients in his ward. So is that true, or is it a conspiracy? Or is the virus transforming people to become cannibals?
No, I don't see that. There's no scientific connection there. There's not. It's not going to turn somebody to a cannibal. No.
Okay.
Thank you.
John Loom, please.
Can you hear me?
Yes, we can hear you. Go ahead.
Yes. With regard to vaccination and mutation, what's the likelihood? As of now, we're especially in the US, they've announced that we're not vaccinating enough at the rate that we should be. What's the likelihood that we will need another vaccine to maybe another vaccine from maybe a more virulent strand of the COVID virus?
I think that as we go forward, it'll be like, I'll make an analogy, but this is not the flu, but with the flu, they know that there are multiple varieties out there, so they make a multivalent vaccine that can address several within the one injection. So I think on a going forward basis, because this thing is going to be around now, they will make multivalent vaccines in years to come.
Okay, so it would be as we currently do every year. We'd have to take a different flu vaccination.
Yeah, the flu mixture is based on predictions of which will be the prominent 4 strains that year. So they make it that way. So this will end up being that in the long run, but in the short run, they're doing their best to get their initial vaccines out, which will be helpful.
Thank you, sir.
Thank you.
Any other question from the audience? You can raise up your hand in the participant section, and you can also write your question in the chat room, and I'll read it aloud. So, Sir James, you can proceed.
So I encourage people to communicate, to listen. Don't follow these conspiracy things. Look at the science, listen to the scientists. Try to go along with your leaders, and hopefully they're getting good scientific support to make their comments. Always keep an open mind and see what makes sense. But in the meantime, some of the things that I'm suggesting you can do over the counter with the vitamin D3, with the guaifenesin, aspirin tablet if you're not allergic or have any reason not to take it. And these should considerably help your situation and help you live more in a better state of health than if you don't do these things, because we're all chronically deficient in vitamin D3, and it sets the stage for terrible disease.
Okay, so we still have 7 minutes, so I don't know whether
Do we have some more questions?
whether we have some questions. So anybody with a question? I can't see any question in the chat room. Neither can I see any hand.
I have a question.
Yes, please go on.
This is John Loom again. My question is, do you foresee any issues down the road with the vaccination that they currently have? Because usually one of the reasons why vaccines take a while to develop is because you need more of a qualitative studies. And from the Pfizer studies that I read, it seemed to be more of a quantitative study more than a qualitative study. It was either this person got sick or this person didn't, rather than, you know, a more qualitative look at the studies.
Well, when you only have 30,000 or so in your study, you don't have the granularity that you're looking for. So as this expands, it's in its application, and they have to report back any complaints or concerns on a continuous basis. This will get a more full understanding whether the new mRNA technology is a winner, or whether one of the more traditional vaccines, such as attenuated virus, where they take the whole virus, but they treat it such that it's not infectious, but creates a good immune response. We don't know what type of virus technology is going to work best. We're only going to know going forward. And the only reason that it's been expedited is because this has been an explosive disease going around the planet, and the mutations seem to appear one place, and then within days they're appearing in multiple spots. So it clearly is something that is of the moment, and that's why it seems to be it seems to be sped up, but they're not doing it with undue haste. They're trying to meet the demand. They're trying to meet the challenge. It's just they can't roll these vaccines out everywhere all the time, and not every country can afford them. So I perceive that we need to have, not instead of, but for the now and going forward, to do the best we can with our health and hygiene to make the world as safe as possible, because considering the limitations of resources. And if the vaccines develop fine, and if they become more available and more affordable, I fully support that.
Thank you, sir.
Thank you. You're welcome.
Any other question from the audience as we conclude our session? Any more question? Okay, so I would request Sir James to make his final remarks as the topic of today and the presentation is concerned. So Sir James, you can make your final remarks on our presentation tonight.
All right. To summarize, this virus has challenges that none of us have ever experienced. And we need to listen to people who are best informed and who are consistent and reliable in their information. I'm trying to be one of those. I'm sure there will be many. We need to listen to science and try to avoid any conspiracy theory. The conspiracy is something that it is a thought process that may not be grounded in the evidence. We shouldn't try to scare people from using a vaccine. People need to be informed. The information on these vaccines is not a large amount of information because they need to bring this available as quickly as possible. So they're watching carefully. They'll adjust it as needed. I support it. But in the meantime, people are sick and dying, and we need to have something to improve people's health and to avoid this illness, or to avoid it from going too far and causing death or prolonged symptoms, or stroke or heart attack even months later after a bad bout of it. So what I've identified with the global vitamin D3 deficiency, I believe is important for people to believe in, and to improve their intake somewhat, and to exercise if they can, and cooperate with the hand washing and the social distancing and the mask. Cooperate with that. It's not going to be forever. The sooner we cooperate, the sooner this will be under control. And I appreciate this opportunity to speak and to answer questions, and I would certainly be available if asked again. I thank you.
Thank you so much. At this point, I would like to welcome Madam Aminia to say something, and then I will invite our CEO, Mr. Hans, to make final remarks. Welcome, Madam Ming. Please go ahead. We can't hear you, Madam Ming. Okay, I guess she's experiencing internet connection problems. As she tries to fix the problem that she has with connection, I would like Mr. Ernst Loom, our CEO, to make some remarks. Sir.
Okay. Okay. Thank you, Mr. Mariko. Thank you, Mr. James, for giving this insightful presentation. I really appreciate it. I had the opportunity to learn a lot, and I'm also sure our viewers had the opportunity to learn from what you said today. So I'd like to, on behalf of all of us from Universal Care for Healthcare for Africa, I would like to take this opportunity to tell you, thank you very much for taking time out of your busy schedule to sit with us on this Saturday and share your insights about COVID-19. So thank you very much.
My pleasure and my honor. Thank you very much.
Okay, and we would like to have you again another time for you to share with us.
Wonderful, I appreciate that.
Yeah. Thanks for being with us today. We really appreciate it. Thank you.
You're welcome.
Mm-hmm.
Okay, thank you, sir. So, Madam Ming, are you in a position to say something? Is your internet connection proper? We still can't hear you. So I think she says she's grateful for you, Mr. James, making your time for the program. So I'm also grateful that you took time out of your busy schedule, as our CEO has said, and graced this occasion. Thank you so much. I will be sending you our certificate of appreciation in the course of the week, just to show how grateful we are, because the information that you have given to us is very fundamental, and it is not easily accessible to just everybody in Africa, and also I believe in other countries, because it is informative and it helps us know which is true and which is false. Like you have heard someone saying that she saw in a newspaper an article talking about people being transformed to cannibals. So you can see how misinformation has been spreading, but you are out there trying to send out information which is accurate, and also trying to tell us what we can do without the vaccine, what we can do to protect ourselves against the virus, which is very important. I've been going through your articles in the social media platform, the LinkedIn, and it has really been very informative. So thank you so much, and I'm really grateful that you chose to grace the UCAF Empowerment Corner program. So
Yeah.
I will.
Thank you.
Mariko, can I quick object, please? Can you please share that with our audiences, so if they want to read that, read some of those articles
The article.
of Mr. Sir James?
Sure, I will send you the link, or we can send you. Okay, I will send you the link of Mr. James, the LinkedIn account. I believe it is called so. I will send you the link, and then you can follow him. You can request to follow him, and I believe we will add you, and then you can be reading and liking and commenting his posts. They are very informative, especially when it comes to the vitamin D3 and the research in COVID. He has really been doing a good work when it comes to that. So you can follow him. I will send you the link on our WhatsApp page. On our WhatsApp, I mean WhatsApp group. So I've sent the link.
What about?
Pardon?
What about the audience? Our audience, if they want to get access to that, can we provide them the link?
Coordinator, where are you going? Link to send us the link. Where are you going? Send the link.
Galaxy A21. I'm sending the link right away. I'm sending the link right away on the chat room.
All right. Thank you, Mr. Mariko.
Welcome, welcome, welcome. So thank you so much, everybody, for the presentation and telling us the program. Okay. So the coming Saturday, we'll be having another speaker. I will just project on the screen. I'm sending the link, but in the meantime, the coming Saturday, we'll be having a speaker, and she has been among our audience. Yeah, that's her. Of Madam Fabian Ina. She's a health expert from Gambia. She will be talking about sexual and reproductive health in the adolescents and the youth generally. So ensure that you avail yourself so that you can learn something from she has diverse experience in this field, so it will really be informative and educative. That is the coming Saturday. So thank you so much for making time, everybody, and especially our speaker for tonight, James Longden. Thank you so much. I believe I don't have much to say.
Okay.
Okay, thank you so much.
Best wishes, stay well.
Okay. Have a good day. Have a good afternoon. Okay, patience as I look for the link. So ensure that you mute yourself so that we don't have some problems. So I'm sending the link so that you can follow Sir James Longden on his LinkedIn media account, so that you can read the articles to do with the vitamin D3 and the COVID-19 research that he has been undertaking.
Okay, thank you, Mr. Coordinator. On the other hand, we have to remember that we didn't get the
Galaxy one, can't hear you. Having a problem.
I would like also. Okay, thank you, sir. I would also like that we have contact. I need to contact you directly. So I think I don't know where you're going to send us.
Galaxy A can't hear you. You are saying something? So I can see we have so many new participants, like Huawei Y6 Can you say something as I search for my for the link? You can tell us your name.
I don't have much to tell, but I really appreciate the conversation, the debate, the discussion. Yeah, I've learned more. Congratulations to James and the team. Thanks.
Okay, welcome. Anybody with anything to say? I'm trying to work with my computer. It is really giving me problems. Anybody with something to say? Okay.
Well, Mariko.
Yes.
Yeah, I'm just leaving. See you, inshallah.
You are leaving?
Yeah, it's Ibrahim. So
Yeah, and ensure that you get more audience for the coming Saturday. And everybody on board, ensure that you also try to get your friends to join us on Saturday.
We will talk in. We will talk it.
Sure. Okay, there is the link. There is the link. There is the link. You have it. You can follow him, and you can read his articles that he has published. He is really he has a rich history in the medical field. He has a bachelor's. He has a master's in chemistry. He has medical whatever. I don't know whatever they are called. So he's really experienced in the medical field. So you can follow him, and you will really benefit from the articles. Thank you so much, everyone. And that is the end of our today's program. I really appreciate your presence. And also I recognize the presence of Bill Lowntain. Thank you so much for joining us. And we will like to see you other times. Thank you so much. Have a good night, have a good day, have a good morning. I believe Madam Aminia, our time is morning. It's around 5 a.m. in Philippines. In the US, I understand that in Cleveland, it's about 3 p.m. And in Gambia, I believe it's around 7 p.m. Is it 7 or 8? Around 8 p.m. So in the different time zones, have a good time. Thank you.